Good evening, all, and a warm welcome to you. I'm delighted to be your moderator for today's session. I'm Preeta Harikrishnan, Deputy Manager of Admissions at Amrita Health Sciences, Kochi campus. Thank you for joining us today as we dive into the fascinating field of respiratory therapy. We have two esteemed speakers with us today who will guide you through key aspects of this course. The topics are Introduction to the Field of Respiratory Therapy as a Profession, and specialties in respiratory therapy within the career path. So to ensure we address all your queries, please feel free to use the chat box to send in your doubts and questions. We'll make sure to clear all your queries by the end of the session. And without further delay, let me introduce our distinguished speakers for today. Madam Riya Ashokan, she will present an introduction to respiratory therapy as a profession topic. Riya Madam holds an MSc in Respiratory Therapy from Amrita Vishwavidyapeetham and has nearly 6 years of experience in ICU settings, sleep lab, and pulmonary function testing lab at Amrita Institute of Medical Sciences. She's also a lecturer and pediatric respiratory therapist in the Department of Pediatric Pulmonology and Critical Care at Amrita Institute. We welcome you and look forward to your expert presentation on the topic. Madam, welcome. Riya ma'am.
Thank you. Thank you so much. Good afternoon, everyone. So without any delay, let me start the presentation. Good afternoon, everyone. So myself, Riya Shugan, and I have specialized in the area of neonatology and pediatrics respiratory therapy in Amrita. So what I wanted to show is that what is your role or what is respiratory therapy and what will be the scope and what might be the future or what is the ensured future of the topic that you have selected today. Okay, so I want you all to take a deep, good breath. Close your eyes and take a good breath. You feels it so easy, right? So what happens if there is a struggle? Yes, that's where we come in. So we are the healthcare professions that specialize in cardiopulmonary care, and we focus in assessing patients, treating and managing patients with breathing or cardiopulmonary disorders. So we help patients to breathe better. In simple terms, we help everyone to breathe, and we are the breath guardians. It's as simple as like that. So what is the history of respiratory therapy? When it began? So it was first begun in the polio pandemic. Like we got to know, many of the countries got to know about RT with the COVID pandemic. So likewise, in 1940s, in between 1940s and 50s, actually this polio pandemic, during the polio pandemic, RT profession came and it slowly evolved with the advancement of ventilatory support. So in these slides or the incoming slides, you will get to know about certain terminologies like mechanical ventilator, ventilation, non-invasive ventilation type of therapies that we mention here. So don't worry, chill. We are just making a patient or a baby or a pediatric patient to breathe easily. Okay. So there are types of ventilators. Ventilators are machines that help to breathe a patient who can't breathe by his own. So evolvement of these ventilator made our profession to become evolved in a more fine-tuned manner. So it was officially recognized and credentialization was happened in 1960s, and from there growth, it was like a clean wave, like a graph that goes up and up. So in Amrita, actually 2009, a master graduation program, that PG programs was started, and soon 2010 itself our bachelor's, that is postgraduate, like UG program started. So the next speaker, that is our Girija ma'am, she is among the 2010 batch, and she will let you know more about these like her experience and being an RP here. So this is actually me, and you will see more slides on pediatrics and neonatology because I specialize in that area and I'm working in PICU. So this is nothing, just helping a patient to breathe better by some missionaries. So what is our role? We are just like, it's not like we work with what to say, work with missions. We work miracles in seconds, it seems. Like we work with patients, we give therapies to make them breathe easily. So we assess them, we monitor them, we check their airways, they manage their airways and give this mechanical ventilation, deal with the we give the maximum good ventilation that a machine can give, and administer oxygen, aerosolized medication. So everyone is breathing oxygen, right? So oxygen is free. So what happens if oxygen is not for free and if it is very expensive? Yes, the time where we struggle, and that's the time where we come in. So assisting with resuscitation and life support, we have a very key role in giving life support. So this is a patient, as I shown before. Let's get we have connected to a non-invasive type of a machine, mechanical ventilation machine, so that baby can breathe easily. Then second one is myself assisting a doctor to help a baby to remove a foreign body. That is, baby had a endobronchial obstruction with a peanut. So where is the area? So where there is breath, there is an artery nearby. Yes, from the delivery room to the emergency room, we are there. So there are acute areas like ICU, acute critical care, and ER rooms, that are emergency recovery rooms, emergency rooms. Then chronic care in pulmonary rehabilitation, sleep medicine, home health care. There are babies or adult patients who require home care, who have long-term ventilation, who are under our care. Then pediatric and neonatal respiratory care. Then about education and credentialization, like the basic education, that is bachelor's in our region, and it depends if it is an associate degree, like depends on the regions, and certifications, CRRT, like certified respiratory therapy and registered respiratory therapy, and even National Board of Respiratory Care in US. But in we have in India association like IARC, that is Indian Association of Respiratory Care, where our our field is being emphasized. Then we have to continue the education for the license maintenance and also for the good patient care. Uh, so as told, it feels easy. It's like when I say it's easy, but it's not an easy job. But every breath a patient takes reminds you why it's worth it. Like the patient might be struggling for a breath, and what we do, and after that, if we see a patient taking a good breath, it will be like all our struggles will be like worth it. So the critical care thinking, the problem solving capacity, and empathizing more. It's not like don't sympathize more than more emphasize, communicate with the patients, and the technical proficiency with equipments like ventilators and our clearance machines, and the ability to work under such a pressure. These are the qualities of a good RT. So it's not just about respiratory therapist. It's like an interdisciplinary team where we have doctors, nurses, physiotherapists, others like clinical nutrition teams, and then social workers. Then it's like we work together with everyone, and even the biomedical team. So RTs are basically a bridge between what to say, the technology, the machines, and patient care. So if there is any chaos, we run and we do our maximum. We try to save the patient life, and we will be cooperating maximum with the team around us. So we have so many specializations or even future opportunities that will be in detail discussed by Girija ma'am. So, as I told, after studying my bachelor's, I have selected my master's in neonatal and pediatric care, and there are opportunities in sleep disorders, transport, intra-hospital, and advanced roles like educator, researcher, manager, clinical specialist, and even professional organizations we can involve with many institutions. So while thinking about the future, don't worry. Like it's like when the world stopped breathing, like in COVID pandemic, we stood still, right? We were the ones we stood still and we breath by breath we helped the world to heal from the COVID pandemic. So that was the like one of the most proudful moment for everyone. So the future means, along with the technological advancement, I assure you that uh, our growth is ensured. An expanding scope of practice, growth demand due to the aging population and chronic respiratory disease that is evolving around the globe. These all will ensure a job. And respiratory therapy, so, to conclude, it's a dynamic, essential healthcare profession which offers personal fulfillment, clinical challenges, and career diversity. So, vital role in patient care across all age groups and settings. So, I think Amrita will be the most suitable place for you all because Amrita provides a wide exposure. We have more than 8 ICUs, like I think around 11 or 12 ICUs here itself, from the neonatal ICUs to the adult, different range of surgical ICUs are there, like any for every department. So you will get the best exposure here. So, thank you. Once again, before concluding, this is me and my patient. Actually, she was having a neuromuscular disorder. She was not able to breathe and she was being mechanically ventilated for two times. And she was about to end, but still, with not only me, with our teamwork, uh, she got better. And this was the photo taken just before discharge. So that's it. Thank you. If you have any queries, please feel free to ask. That's it.
Thank you, madam. Your video was not on. We couldn't see you much, but then this was a very
Okay.
crystal clear presentation from your side and a lot of motivation, showing us how sick patients were really in your hands and how you could save them all. So that was a real motivation. So I'm so happy that you could present to us such a great presentation. So let's now go on to Madam Girija Vijay Kumar. I welcome her so we could hear to what madam also has to say. But before that, let me introduce you all to our Madam Girija ma'am. She is a 2021 graduate with both B.Sc and M.Sc in Respiratory Therapy from Amrita Institute of Medical Sciences, Kochi. She is certified in basic life support by the American Heart Association and serves as an advanced cardiac life support instructor through IEMS, Kochi. Currently pursuing her PhD at Amrita, she brings 13 years of teaching experience. Today, she will discuss the specialties within respiratory therapy as a career. We appreciate to see your valuable insights on this particular important topic, ma'am. Welcome for your presentation. Girija, ma'am.
Thank you so much, ma'am. Thank you for the warm welcome. So without much ado, I just share my slide. I'm audible, right?
Yes, yes.
And hope my slides are also visible.
They are.
So Ria ma'am has already given you a brief introduction on what is respiratory therapy program. So I'll be focusing more on the specialties in respiratory therapy within career path. So just to rewind what Ria ma'am had told, basically, respiratory therapy is an allied health professional which focuses on diagnosing, treating, and managing patients with breathing as well as cardiopulmonary disorders. So the key aspects related to respiratory therapy are we play a role in assessment and diagnosing. That is, we through various respiratory function tests like spirometry, we perform various blood gas analysis where we'll be looking for certain respiratory gases in our blood, and through various imaging studies like chest X-ray, lung ultrasound, CT scan of the thorax, we play a role in assessment as well as diagnosing respiratory or cardiopulmonary disorders. We also play a role in treating patients when it comes to breathing difficulty. Obviously, many patients come with distress in such a way that they have reduced oxygen levels. So we play a role in initiating oxygen therapy to the patients. In some cases, patients may not be able to be maintained on just simple oxygen therapy, where we need to escalate our treatment by providing some ventilation through machines like which the MM already mentioned you, something known as mechanical ventilators. Also, we deal with certain drugs via nebulizers or inhalers we provide to patients in order to ease their breathing difficulty. We also play a role in educating patients as well as their family members regarding various chronic lung diseases, as well as we play a role in smoking cessation clinics where we motivate and educate patients to stop smoking. As we all know, smoking causes various lung disorders. We also play a role in emergency care, where respiratory therapists will be posted in casualty departments or in emergency departments, where patients who come with sudden respiratory or cardiopulmonary distresses will be attended by us too, and we help in relieving their distress. We also have a role in pulmonary rehabilitation, where some patients who already have long-term lung disorders or heart disorders or maybe neuromuscular disorders, as Riyaman had showed previously in her slide, some patients may require some amount of rehabilitation, where we'll be providing certain respiratory physiotherapy care, some breathing exercises, so that patients will be able to carry out their simple, basic daily lifestyle things to be done, and thus helps in improving the quality of their life. So here at Amrita Institute of Medical Sciences, respiratory therapy comes under the division of, Department of Anesthesia and Critical Care Medicine. And I think you may be familiar that our B.Sc program is a 4-year program, 3 years degree plus 1 year of internship. So the opportunities related to respiratory therapy is quite fast growing, especially if our respiratory therapy students or the respiratory therapists have good skills in cardiopulmonary, managing cardiopulmonary disorders and identifying various cardiopulmonary diseases. Also, now our scope of practice has been spread to various rehabilitation centers, to home care facilities as well. So, yeah, so when it comes to critical care units, we usually respiratory therapists work as a team along with doctors, nurses, and other specialists in order to take care of various underlying cardiopulmonary disorders and help them breathe easily. Respiratory therapists can also you'll be getting a good exposure in handling various mechanical ventilators and in assisting various respiratory related procedures or cardiac related procedures. And if you have a good exposure, you can also reach in a supervisory level. You can work as team leaders, as respiratory therapy team leader, depending on your skills you have gained and the experience you have gathered. We also get exposure in pulmonology department, pulmonology outpatient departments, where we'll be performing various pulmonary function tests, as I mentioned earlier, which a few tests like spirometry, lung diffusion capacity, sleep study. Sleep study is one really vast area where respiratory therapists will be conducting a particular procedure called sleep study, where you will be learning about various sleep disorders in a vast range of ages, starting from pediatrics, or it can be adults, various sleep disorders. Patients come with various sleep disorders, where the respiratory therapists will be conducting sleep studies. And you can also level up your education by undergoing master's program. You can also learn, undergo, or you can learn various certification programs. I can work as academician in the field of respiratory therapy itself. If you're willing to study, go for higher education, you can also enroll for the PhD program and you can work as a research scholar, either part-time or full-time research scholars. Our opportunities are, again, not limited only to hospitals. Various respiratory therapists also work with various companies, medical companies like Hamilton, Philips to name, where we work as clinical specialists. And you can also work as entrepreneurs, where you can start up your own clinic to perform either sleep study or pulmonary function test, whichever is your wish. So why to choose Amrita? So the institution itself prides on its state-of-the-art facilities and the utilization of advanced medical treatments, all geared towards providing optimal care to its patients. What sets Amrita apart is its unyielding commitment to treating each individual with utmost respect, empathy, and kindness. Students not only receive a world-class education, but are also immersed in an environment that prioritizes holistic patient care. So that's all from my side. Thank you for your patience.
Thank you, ma'am, for that. Again, a very short but crisp presentation where you could add to respiratory therapy and what you all do there. So, madam, a few questions, like any one of you could answer. What are some common work environments for respiratory therapists? Like you said, it's like it's again connected to anesthesia and emergency also. Like, are there any other environments where these respiratory therapists would have to work?
Yes, I think I'll answer you.
Yes, ma'am.
Yeah. So apart from critical care areas and anesthesia and critical care, we can also work under the pulmonology department, which is we will not be dealing with critically ill patients. We'll be dealing with patients who come to the pulmonology OPD, pulmonologist, where we will be performing various diagnostic tests related to their lungs to assess their lung function, to assess their lung capacity. Maybe we also conduct some allergy tests, like some patients may have severe allergic reactions to maybe simple dust, or it can be something else, like in food also. So we respiratory therapists conduct such tests also, allergy tests, where we can identify what is the triggering cause for a patient to develop this sort of breathing difficulty. Then, as I said, apart from hospital area, we also can get, we can also work in long-term care settings, like patients who are already bedridden, but they may require mechanical ventilation support. So we can go on home care, we can work in a home care setting where we would be visiting patients who are in the home, who don't need hospitalization, but still need mechanical ventilation support and our care. And apart from this clinical job, as I said, if we have higher degrees, we can also work as academicians in the same field itself as academicians.
Yeah, that's what you said earlier. Madam, what advice would you give to someone considering a career in respiratory therapy?
First of all, you should have empathy. As I said, we are dealing, as myself and Ria said, we are dealing with patients who come with different kinds of severity. Some may just come with a simple sneezing. Some may come with a respiratory arrest. Someone will be coming who's unable to breathe, who cannot breathe at all. So empathy, compassion is very important. Whomsoever chooses this course, it's not like any other kind of a technical course where you're not coming into a direct contact. We as respiratory therapists would directly be coming in contact with the patients, with the bystanders. So our knowledge regarding their disease, our empathy towards the patient plays a very role in managing patients. Ultimately, our aim is to bring the patient back to life, help them breathe normally. So yeah,
that is one
my
of the
side, these are the points.
Okay, thank you, ma'am, for that. Ria, ma'am, can you just answer this? What factors should an aspiring respiratory therapist consider when specializing in this particular program?
Like factors like first thing is physical health. Like for someone, I think everyone is like we are dealing in a critical care. If suppose someone wanted to be in
Specialize in
clinics,
some. Okay.
yeah, wanted to be in clinics rather than an academician, that person should be at least physically fit for the job. Like if you are healthy, like I'm not demotivating anyone, I'm just helping everyone to stay healthy, so that in clinics, what already our patients are sick and what we will be having a mentality to stay there, stay in clinics. Will deal with patients. We will like help them to like help them to fix machines with a fixed mask, everything. So we will be in a clinical care setting till the patient becomes better. It will be like 6 hours. Sometimes it will be like 2 hours. Sometimes it will be days. But for a clinician, for a good RT, we should at least be staying for 9 hours or 8 hours. So health is important. So someone who is ready to work should have a good proper health with a proper diet and all. Second thing is like of course a dedication, that for any aspect, that is also a key thing. And communication skill, as Girijama mentioned, we are dealing with patients, and like for my clinics, I will be dealing with pediatric patients. Like babies are not just like adults who will just understand when I say sit down. They won't be sitting down. They will be already in a like a claustrophobic or have in an anxiety situation. So I have to make them comfortable and make them sit and make them listen to the like listen to their things. I wanted to like initiate something. I have to make them in the most comfortable manner. So communication and being empathizing is very important. And I think that is the most thing. If we are dedicated and ready to work, then everything falls on the way.
Okay, thank you for that, ma'am. So, the role of a respiratory therapist, like like I heard madam saying earlier, like there is this home care settings. So, how do they like actually? How are they sent to such home care settings?
It's like if a patient is requiring ventilation or just a degree down to that, that is minimally invasive or non-invasive type of ventilations are there. So there are certain degrees of mechanical ventilation. So there are certain patients, bedridden patients. Just for an example, suppose a patient is having stroke, patient might need to continue ventilation. So patients pulmonary muscles will be weak for a so like if the patient is hospitalized for more than 2 or 3 weeks, it's deconditioning of the muscles will be there. So these patients are sent to rooms or nearby locations or nearby home care settings where we goes there, give 1 hour of therapy, we make them, we communicate them to them, we educate them. There is a necessity of breathing exercises. We provide them with such certain like inspiratory exercise where we help them to strengthen their lung muscle endurance. There are certain terms like endurance and all. Then if a patient is on ventilator or like home care BiPAP and all, we help them to remove these, and we help them to have a good quality of life at home. So what patient, if a patient is admitted in hospital or any clinic in ICU, the cost of living is too much for them. So if we are ready and if their clinical situation is some kind of long term, the them and we can see videos or really record this, and
I think your voice is breaking, ma'am. Like,
we
uh, is it clear?
hello
Yeah, ma'am.
hello
Yeah, ma'am. Can continue, ma'am.
Basically that like we can go weekly in a weekly basis or even in a daily basis, and those aspects are according to the severity of that patient's particular patient's disease. So the what program we give to that patient is according to the patient's physical condition, like the medical diagnosis what the patient is having. So I can't tell you it's like 1 week program, 2 week program for 1 hour and all. It depends.
Okay. So what is your job opportunity both in India and abroad?
Uh, in abroad, and in India, as I told, so many super specialty hospitals are being developed, and I think for or in every super specialty hospital, wherever there are ICUs, there is a need for RT. So it is increasing, and in outside India, the competition is more. Like, am I audible?
Yes, yes.
In Western countries, there are posts for academics and even for pulmonary diagnostic postings, like where we can uh, be in settings where we can give the patients pulmonary function testings, and we can be in sleep labs, as Madam had mentioned before. There are certain settings called sleep lab, polysomnography. It is mentioned like that. So, assessing a patient for sleep disorder, and there are even different department for sleep medicine, so we can be a part of that. Mm, then ICU settings, and even in NICUs, every NICU there is need for RTs are becoming uh, more as if they need necessity. The necessity for an RT is becoming more and more day by day. So I hope
So they
wherever
have
there is chaos and chaos for breathing, RTs are a part of that.
yeah. So they have lot of opportunities. We don't have to worry. All the respiratory therapists of Amrita, once they complete the program, are placed. Is it, ma'am?
Yes. Girja ma'am knows better because she's the first batch here.
I see. Okay. So that's nice to hear, ma'am. Now there is someone asking, what are the subjects included in this program?
Okay, fine. So when it comes to subject, like since till 12th, you might have learned about biology, physics, chemistry, and all. So when it comes to respiratory therapy, again, we'll be having lots and lots of branches under biology itself, which is something known as anatomy. You'll be learning about various body structures and parts. Physiology, where you'll be learning the functions of each body part. Then there is something as biochemistry. You'll be learning about various biochemical reactions that happen in your body. Then you'll be having pharmacology, where you'll be learning about various medicines that are being given to the patients. Then you have pathology, where you'll be learning about each and every disease condition affecting the body. Then when it comes to respiratory therapy, we have purely our own department subjects where you'll be learning various patient contact techniques. You'll be learning about mechanical ventilators. You'll be learning about pulmonary function tests. As I mentioned before, sleep study and pulmonary rehabilitation techniques. So these are the just basic overview of the subjects that you'll be dealing throughout these 3 years. And once after this 3 years course is completed, 1 year Pakka internship will be provided, where you'll be you'll be given hands-on training.
Okay. Thank you so much for that, ma'am. There is another question like asking, how is it different from perfusion technology?
Perfusion technology, they completely deal with the heart and the circulatory system, and their working environment is only in the operation theaters. So cardiac perfusionists, basically, they'll be working with cardiac surgeons, where while the cardiac surgeon performs heart surgery, the heart needs to be still. So if the heart will be stopped for quite a bit while, and then only they'll be able to perform surgeries on the heart. So while the heart is being stopped, to maintain circulation, the heart circulation will be diverted onto a machine, a cardiac perfusion machine. So cardiac perfusion technology usually deals with this machine part and various other cardiac surgery related supportive machines will be dealt with the cardiac perfusion technology. Their work environment will be more in the operation theaters, cardiovascular operation theaters.
Okay, thank you so much, ma'am, for that. Is it possible to just tell them like what would be the starting salary range for respiratory like they are eager to know that also.
Sure. You'll be starting with a very decent amount. Minimum of 20,000 to 25,000 is a starting salary for an undergraduate student. And further, if you attain further other skills, certification programs, or if you complete your post-graduation, then obviously you'll be being started off with a better salary.
Yeah.
Minimum is usually 20 to 25,000, or within care lifestyle, also care life a bit more higher.
Okay, once they go to Gulf or abroad, that will be even more higher.
Yes, definitely.
So many of the alumni are still like, you have anyone to tell, like any alumni who have been working abroad and
Yeah, definitely. We can't just keep it in our fingers.
yeah,
Almost all the alumni after getting experience from Amrita flies. Many in academics and more of them are in clinics in Saudi, Bahrain, Oman, even in UK. In US, one of my batchmate is like she finished masters in like from US, and she is working there currently, and two of them are in UK, and yeah, I think most of the alumni get paid.
so that would also make these people happy, all the attendees over here. So anyway, madam, before we bind up, we have something about the admission process that should be told. Like we have Sanuja from the admissions who will guide us on the admission process this year. So let's listen to Sanuja, and then we'll quick wind up the webinar. Sanuja, welcome.
Thank you, ma'am. I am Sanuja from Admission Office, Amrita School of Medical Sciences, Kochi campus. Amrita ranking top. Amrita offers 17 allied health sciences programs, and B.Sc Respiratory Therapy is one among them. And duration of the course is 3 years plus compulsory 1 year internship. And the minimum age should be minimum age should be 17 years of age and maximum 23 years as on December 31st of each academic year. And the candidate should pass in physics, chemistry, biology, and 60% aggregate marks. For all specialities, selection for candidates will be based on the rank obtained in the Amrita entrance examination, that is AEEL. And the allotment of seats for the shortlisted candidates will be done after the entrance exam and interview. Our website link is amrita.edu/admissions. Registration portal is applyug.amrita.edu. And the examination link is amrita.edu/admission/AEEL. And you will get all the informations in our website. And now the portal is open. You can register through our portal ID applyug.amrita.edu. And the exam will be computerized online exam to be taken at respective centers allotted to the candidates. And the syllabus is based on physics, chemistry, biology. And duration of the entrance exam is 2 hours, and the total number of questions is 80. That is physics, chemistry, biology, each 25 questions from physics, chemistry, biology, and 5 questions from English. And total 240 marks. For every correct answer, you will get 3 marks, and every incorrect answer, -1 will be deducted. Coming to the fee structure for respiratory therapy, we have three categories. First one is scholarship category, second non-scholarship category, and third NRI. For scholarship category, the tuition fees will be 1,80,000 per year, and for non-scholarship category, the tuition fees will be 2,60,000 per year. And for NRI category, you should pay in dollars, that is 4,500 rupees. And for first year, you should pay admission processing charges of rupees 2,500. And for both categories, the other fees will be 41,000 per year. And the hostel and mess fees will be 80,000 per year. The hostel is not compulsory for those who residing within 20 kilometers. Coming to the registration steps, we have 6 steps for registration. First one is register with your email ID and password. And second one, profile. You have to fill your personal details, mail ID and all. And third one is courses, that is programs. You have to select the preferences. And fourth one is payment. You have to make a payment of rupees 550. And we have 5 methods of payment. You can select any one of the method. And fifth step is academic information. You have to upload your academic details like 10th and the 10th school you studied and all the details you have to mention in academic information. And the last one is document uploads. Now, whichever documents you have, you can upload in it in the portal. And after the +2 results, you can upload your mark sheet in the portal. And the admission inquiries, you can put a mail to ugadmissions@aims.amrita.edu. And admission office contact numbers is please below given is our admission or contact numbers. You can also given it in our website also, that is amrita.edu/admissions. And any inquiries, you can please feel free to contact us. Please point out that Amrita Vishwavidyapitham has not appointed any agents or third-party clients for securing admission. You can call admission office. Only you can call the admission office for such inquiries. Thank you. And over to you, ma'am.
Thank you, Sanuja. I think it is clear. Like we have this AEL exam somewhere on the 3rd or 4th week of May. The mail, you will get an email regarding that. Please keep checking your email. The subjects that you have to study is +1 and +2 biology, physics, chemistry. That also you can, as she has just shown, you can go through the website and you will get all the details regarding what is the syllabus and even sample test papers, practice papers that you could do there. So all the candidates, all the attendees who have attended this webinar should surely be happy that you could collect such a lot of information from our experts who are so young and energetic, and they have conveyed to you such a lot of information. So I'm so happy that you have taken such a lot of your precious time to be with us this webinar. And I am also happy that there is a lot of you who have joined us today. We expected even more. I think they might have been busy with something else. Let us feel so. So it was an absolute pleasure having all of you with us today. So I think it's now time. Any other doubts from the attendees you could just ask, or then we could wind up this webinar. Is there any doubts from anyone? Any more doubts? I think they might all be clear because you have all mentioned, both of you have really explained it so well to them, so they need not have any doubts. So I am so happy that we could wind up the webinar for now then. So we found the session very insightful and engaging too. So I like to expend my deepest gratitude to our speakers as well as to all who have joined this webinar and made it a success today. Thank you once again, and hoping to see you all soon in the Amrita campus. Thank you. Take care.
Thank you.
Thank you. Thank you.